Regarding the anti-reflux operation, that is a nissen fundoplication, many patients are asking about the recovery and what is the danger of the operation, what the problems I'm going to face after the operation, and what is the recovery time and what is the success rate of this operation. Nissen fundoplication is one of the time-tested operations for reflux. In this operation, the abnormal anatomy which is causing the reflux is rectified. So we repair the diaphragmatic crura, we increase the length of the intra-abdominal esophagus and also create a valve so to prevent the reflux. This is a most effective operation. This is a very commonly performed operation, very well established surgery. The complications of surgery is very minimal. During surgery there can be some risk of bleeding when you take down the vessels along the stomach, that's called the short gastric vessels. So we have wonderful devices called the ligashore, the harmonic, etc., the thunderbeat. So we divide these vessels with these devices. So the risk of bleeding also is very minimal. There is small chance of injury to the adjacent organs. A well-trained surgeon who has done nissen fundoplications, this is very safe in those hands. The technique of surgery is very well established. The chance of having a complication during surgery is mitigated because of the devices what we use and the wonderful lab system, the robotic systems what we have. These are the two important complications of surgery during the surgery. After the surgery, some patients experience some discomfort when they swallow food because there is a valve which we have made. So this wrap, the fundal wrap, acts like a valve. So only unidirectional flow will be there. The reflux doesn't happen. Initially it will be very tight. Though we make a floppy valve, some patients do experience a difficulty to swallow. So they have some discomfort. They have something like a catching kind of thing in the chest. So all of them may not have this problem. Maybe up to 20-30% of these patients have some discomfort when they swallow food. Also they have some difficulty in belching. They have some discomfort, but eventually most of these patients within few weeks time after the operation they are going to overcome this. So if you see the long-term results of a nissen fundoplication, the operation is very effective operation. In the long term also more than 90-95% of these patients are completely symptom free. They can stop the medications and they can enjoy a wonderful quality of life. It's very important to select the right patient for surgery. So please subscribe to the channel and go through the videos where I have spoken about the indications when to go for surgery for acid reflux. We don't do surgery for every patient who comes with acid reflux or hiatus hernia. There are a set of patients who will qualify to undergo this procedure. Regarding the recovery after surgery, because this is a laparoscopic procedure, the pain is very minimal and most of the patients can go home in a day or two after the surgery. Within a week you can go back to office, your routine works.